Greetings. My name is Dr. Lipi Roy. I'm a Duke-trained and former Harvard doctor who specializes in addiction medicine. And today I'm going to talk about ways to reduce stigma towards people with addiction by changing our language. So as of right now, in society, we tend to use phrases and words that are pretty tough, punitive, punishing, very stigmatizing. We'll use phrases like substance abuser, drug abuser, or substance abuse, drug abuse. We use the phrase war on drugs. We'll say, we'll label people as junkie, cokehead, addict. And we also, in clinical settings, in labs, we'll say things like, oh, your urine is dirty with, your urine is dirty with heroin, alcohol, whatever. And yet, my patients with diabetes, if one of them, say, ate a whole box of cookies in the morning, resulting in a blood sugar of 600, I don't say, oh, you've been abusing chocolate chip cookies, or you've been abusing donuts, and as a result, your urine is dirty with sugar. We just don't use that kind of language. In that case, I abused ice cream last night while watching TV. We just don't use that type of language towards people with other chronic medical diseases like diabetes, heart disease, lupus. Yet we do it with addiction, which is also a chronic medical disease, a disease of the brain. And when patients or people with addiction hear language like that, abuser, dirty urine, they tend to perceive more discrimination and they are less likely to seek help. Studies also show that healthcare professionals like doctors and nurses, physician assistants, nurse practitioners, they actually have less regard for patients with addiction. They perceive people with addiction as being manipulative, angry, violent, less motivated, and they spend less time in clinic. They have shorter visits with people with addiction. All of this adds up to suboptimal care. So instead, I offer an alternative to reducing stigma by changing language. So I invite all of you to start adopting language that's more compassionate and less stigmatizing. Let's use phrases like substance use disorder or a person with substance use issues. Let's say things like your urine is positive for opiates, not dirty, but positive. When studies show that when we use language that's more compassionate and less stigmatizing, patients feel less judged and more respected. They are more likely to seek help. In addition, it also improves the therapeutic relationship between the patient, and the provider, prescriber, doctor. So overall, when we use language that's more compassionate and less stigmatizing, people are more likely to seek help. So hopefully we can all work together to make these changes, and remember to pass it on, pay it forward. Thank you so much.